It's a delight to see so many of you here this morning, and a delight to see so many familiar faces. You can't hear it back. Who cannot hear what I'm saying?
Kiss the mic.
There are a few seats right at the front looking at the audience, but you'll be able to see the speaker. So if you want to move to these seats here, can you hear me still? Okay. Can't get any closer to the mic. Can you hear me now? So our speaker will also have to shout. So good morning and welcome. We certainly have a full house here this morning, as we thought we would for this topic. I'm Brenda Russell. I am the president of the UIC chapter of SUAA, the State University Annuitants Association. SUAA not meaning that shitty stuff we flush away. That's the medical plan. I'm sorry. So, how many of you received a yellow letter like this? All right, I'll ask the other way. How many of you did not receive? Those of you who did not receive it, either you should be getting one, or you are not affected by these health insurance changes. The not affected people are, they're Medicare ineligible. The main reasons you're not Medicare eligible is you're under 65. This is for you and your dependents. So you might be over 65, but your dependent might not. The second thing is, you worked your entire life in the state university employment system, and you didn't pay into Medicare. That was changed, 10 years ago or something like that. But if you retired more than 10 years ago, you will not have built those service credits up. That's you, the employee. You might have a spouse who is Medicare eligible, so you might have Part A through your spouse, but it's not you. So you didn't get a yellow sheet. But if you and your dependents are both now paying Part A free and Part B monthly, you should have got this. If you didn't, come and see us afterwards and we'll tell you how to get re-enrolled with CMS, okay? But nobody left the room, and we still have people coming in. And are there any empty chairs anywhere?
But I'm coming back.
One here, one here, and the one that the speaker will not be using when he rises. So, a couple of business plugs, yes?
Even if we're not 65 yet, but we're close.
I'm not going to take questions just right now. If you're not 65 yet, you won't get the...
Right, but won't it affect us when we are
I'm going to have a ton
65?
of questions. Maybe I'll go to that next. We're going to have two ways to have you do questions. One is to write them on these 2x5 cards that either have or will be passed out. We'll collect them. Some of the questions on this topic are quite personal in terms of medical conditions or age and situation. So that's for both anonymity and, frankly, so that we get the questions stated clearly in the mic and everyone can hear it. And then we'll have soon, I hope, a mic we can pass around that you can ask questions from the floor. This is going to be mostly a question and answer event. Here are some plugs. On our board, we need new members. We need someone to do publicity, someone to help out with the health insurance. We also, all of you, if you find we're being helpful, please join SUAA. Where is Marsha? Marsha wants to make a plug for membership. You have to come up, Marsha.
We're so glad to see all of you here today. And but I do need to make a plug for membership. If you're here and you're not a member, I'm sure you're here because you got information from someone who probably was a member. And we are the only group that's working actively on your behalf right now. Our membership right now is down, and there's no reason for it. We need everybody here today. If you're not a member, you need to join us. I mean, we cannot continue to do our work unless we have members. We have a staff in Springfield. We have lobbyists there also that are working all on our behalf. And so it's less than $3.50 a month. You can sign up by dues deduction. Most of you already have a form if you don't see us at the tables. But please don't leave here without joining SUAA. We need you.
That was Marsha Borders. She didn't say it, but she's on the executive committee and spends a lot of time going downstate and working with people from all over the state. We are being webcast. Thanks to Jim Limber back over there. He's almost certainly sent the link out already. We know we have a lot of people who are not able to travel, either through health or because they no longer live in the Chicagoland area, but they're still affected by this. So, webcast, you can replay this later, send the links to your friends, and welcome also to those people remotely connected in this virtual world. But that does mean too, if you ask a question, you may be identified along with the question. So again, the reason for the cards. I'm on to hot off the press. So I don't have one of these yet. This is the card that CMS will be sending, and it still doesn't, and it tells us that the packet will be coming. Sorry, rolling eyes for those who can't. They could have saved the postage. They could have saved the postage, exactly. Now it's my pleasure to introduce our speaker for this morning, who has said he welcomes questions early and often, and we think he's used to dealing with groups, maybe not this big, but this interested in health insurance. Our speaker is John Baran, who's a CPA. His entire career has been in healthcare. He was with PricewaterhouseCoopers, which, as you know, does healthcare audits. He's been in large hospitals, small hospitals, holding the position title of things like Chief Financial Officer. He himself is one of our retired club, and he moved to Illinois to be closer to his grandchildren. And I've met his wife Kathy and John, and the question, it's sort of like they're in somewhat the same boat, understanding and going through the crises, but with his experience, he then became, we're looking for something else perhaps to do here, and he became a SHIP person. Now what that is a senior health insurance program, and Illinois has people like John who work throughout the state at senior centers where people can go and ask health insurance problems for seniors. So he has now got that training. And with that, I will sit down and introduce John. Thank you, John.
Thank you.
I'm one of the few people. We're originally from New York. When we retired, usually you retire and you go to Florida. No, we retired and came to Chicago. So there's something a little different there. I also, thank you very much for that introduction, Brenda. I also want to state that who I'm not. I am not an insurance agent. I'm not an insurance broker. I'm not a investment advisor. I'm not a financial counselor. I'm not an employee of CMS. I'm not an employee of any of the managed care plans that you're dealing with. I'm a volunteer. I'm a shift volunteer helping folks work through the whole Medicare morass. And actually, I rather enjoy it. So that goes along with moving, retiring, coming to Chicago, I guess. So what I want to do is there's 4 or 5 things I would like to go over. First, just what is Medicare? What is the traditional Medicare? What are Medicare costs that you and I are going to incur and have incurred? What is this Part C all about? And I'll go in some depth there because that's obviously something that's very important to this group right now. I'd like to briefly cover what Medicare does not cover. And then lastly and shortly, just what impact does the Affordable Care Act have on Medicare and what you folks are doing? Now, when I get all said and done with this, I know that there's 3 questions that you folks want answers to. And the first question is, if I leave the state system, what will it cost me? Second, if I leave the state system and go to traditional Medicare, are there any issues with getting supplemental insurance? Are the guarantees in place? And 3, if I stay in the state system, what's going to happen with the doctors and hospitals that I use? Can I continue to use them? So as I go through the parts that I'd like to cover, I'm sure those are the 3 questions you want answers to. And we didn't put up metal detectors as you came through here. So I hope no one's armed. I have some answers and some opinions. So let me go through that. And again, if you have any questions, if something I said is not clear, just wave, let me know, and I'll try to expand upon it, make it clearer. First, the Medicare overview. There are really 5 components, 5 to Medicare. 4 parts and it's a supplement. Part A, Part B, Part C, Part D, and Medicare supplement. Pretty easy so far. Part A and Part B are referred to as original Medicare or traditional Medicare. That's the part, those are the 2 parts that were passed in 1966. Now also, for some strange reason, I remember that debate. I was like an 18-year-old kid at that time. I remember the debate going on about Medicare and Medicaid. So that goes back to 66. In Part C came into effect in 1997 as a growing part of the desire for managed care. Part D came into effect in 2006, and as you all know, it is the prescription drug coverage. Now, Medicare is a terrific program, but it was never intended to cover everything. Hence, there's the deductibles, the co-insurance, the co-pays that cause out-of-pocket expenses. So again, the 3 things that are going to cause out-of-pocket cost to you and me are deductibles, co-insurance, and co-pays. Deductibles we all know about. Co-insurance is always a percentage. So like Medicare Part B, you need to pay, we all pay 20% of the Part B charge. Co-pays are always fixed dollar amounts. So like in your prescription drug coverage, when you pick up a prescription, there might be a $10 copay or a $20 copay. Or as you look at the plans that are being proposed here for you folks, there's on the HMO piece. So, as a result of those so-called gaps, there was an insurance product that was developed called Medicare Supplement Insurance, or Medigap or Medicare Sup, or Med Sup. So those are policies, an insurance product to cover the gaps, to cover those costs that Medicare does not pay. Now again, Medicare A covers hospital inpatient, some other things, but primarily hospital inpatient. Part B covers hospital outpatient and physician services. Also some other things, but primarily hospital outpatient and physician. Part C I'll come back to. Part D covers the prescription drug coverage. Now, I passed out, you got two pieces of paper. The first piece, these are the co-insurance and deductible amounts in effect for 2014 if you have traditional Medicare. They were similar in 2013, but these are the 2014. Yes, ma'am.
We ran out, and I'm having more made, and as soon as they get brought up, then we'll get them passed back to everybody, so you know.
Share, I should give one of the code.
Yeah, and if you have any at your table, please share. That'd be great. But I got another 250 coming, so we should be covered.
So, there are those three things that cause us out-of-pocket costs: deductibles, co-insurance, and co-pays. So the Medicare supplement insurance was intended to cover those gaps. On the third page, Medicare supplement benefits. Now, here's sometimes it gets a little confusing. There are 10 plans that one can sign up for. And they're called, ma'am?
You know, for the most part, people here do not have Medicare Sup. Because our state insurance was our secondary insurance, so that doesn't really apply.
I know, but you may be
anybody
going
here.
to it though.
Okay. The other thing I would like you to also, I hope you will be talking about Medicare assignments
Yes,
and reasonable and customary.
yes. And very important points. But if you're going to go into traditional Medicare, if you're going to go out of the state plan, then you have to consider a Medicare supplement policy. 10 plans named or with alpha designation, Plan A, Plan B, through Plan N. Now, as you look at this sheet of paper, you'll see the check marks as to which items those plans cover. Plan F is the most comprehensive. Plan A is the least comprehensive. Plan F is the most expensive. Plan A is the least. So, let's go through what the costs are going to be in traditional Medicare as a benchmark that you could use going forward. No premium for Part A. That we paid for during our working career through our FICA tax. So there's no premium for Part A. Part B is a monthly premium of $105 per person. But let's just stay with the individual. $105 per person. A typical Med Sup plan, Plan F, costs about $1,900 a year, which is about hang on, let me, I did that math. Is about $155 a month. And that's for the Plan F, the most comprehensive. The Part D, the prescription drug coverage, at a minimum, is going to be $30 a month. It's going to be more depending upon the number of prescriptions you have and the types of prescriptions. So, but as a benchmark, the starting point will be about $30 a month. So, between the three, Part B, Supplement, and Part D, it's going to be just shy of $300 a month. And that's a reasonable number. Here it is, yes. About $300 a month. Again, it will be more if your prescription drug coverage is costs more.
Could you repeat that? What is 300?
300 will be the benchmark for traditional Medicare that will cover Part A, Part B, supplemental insurance, and Part D, prescription drugs. So again, Part A is $0. Part B is $105 a month. Part D, a minimum, is going to be, or the supplement is going to be about $1,900 a month. I'm sorry, a year. Works out to about, for Plan F, works out to about $150. And Part D, prescription drugs, is going to be at a minimum $30 a month. So, it's the premium. I take, as an example, I take 3 minor prescriptions, all generic. My total cost, including premium and co-pays, works out to be about $30 a month. Again, it depends, though, on the prescriptions that you have if you're taking. I'm just saying, as a benchmark to evaluate where you are and where you want to go, it's going to be $300 for traditional Medicare. Sir?
Those of us who are already on Medicare already pay that premium.
Yes.
So that the actual additional cost would be $105 less.
That's right.
I mean, additional cost, not actual cost, but additional cost. So if you are already on Medicare,
then this,
You should repeat it because the webcast gets it.
I know, but let me just hear it.
if you are already on Medicare, you are already paying the $105 premium a month, either as a deductible out of your Social Security or as a charge which you pay $315 every 3 months, which you get a bill for.
Right, so to repeat it, if you're already on Medicare, you're already paying $105 a month. So when we talk about what the incremental cost will be different than what I have here. That's why when I give you what the cost could be stated in the plan, I also include the Part B so that we're comparing incremental costs.
Yes, when we're talking about these plans, they're all individually issued, correct? So if you are in the state plan now with a dependent, all that changes because each of you then have to buy your own policies. Is that what's happening?
The short answer to your question is yes.
Question?
The supplemental plans are individual plans, and that's correct. In the state of Illinois, there's approximately 50 insurance companies that offer these supplemental plans. Not each insurance company offers all 10. Some do, most don't. They'll offer certain of the plans, A, B, F, and G, or whatever. So, 50 insurance companies offering supplemental plans. They're individual plans. So if there's you and your spouse, you need 2 plans, one for you, one for your spouse. Bam.
That's the ones that refer to as the Medicare plan?
Yes. Yes, those are also called Medicare plans. are referred to as Medigap. It just depends on how much of the gap each plan eliminates. Plan A only eliminates a small portion of the gap. Plan F eliminates all of the gap.
Plan F called Medicare Plus.
No. No.
You have to repeat the questions.
Is Plan F called Medicare Plus? No. And when you go to the insurance policy, they'll exactly state in the policy, this represents a Plan F, a Plan A, a Plan G. And every insurance company that provides a Plan F, the coverage items have to be exactly the same. So you don't have to evaluate coverages. You simply have to evaluate your comfort level with that insurance company. Question over here. Ma'am.
What about dental and vision insurance, which we get now under the state, but are not going to get anymore?
Medicare and the supplements do not cover vision, dental, or hearing.
So we'd have to get separate policies for
Yes,
that?
yes.
Excuse me? Yeah, I read something that said that that's not going to change. That we will keep the dental and the vision and...
So there's a two-part answer here. If you're in traditional Medicare, like I am, it does not cover vision, dental, or hearing. My understanding is, in your proposed plan, you can continue to get dental coverage, but at a separate premium. So, but that's, as you do now. Yeah.
So, everybody's totally confused. We're getting different responses from different people. We're trying to check them to the highest authority, and sometimes two highest authorities are still disagreeing. So all we can tell you is the best we think now from reading all these things. I mean, this is not a question you would know, this is an in-house question. Don't hold me to it, but we think that if you stay on Medicare Advantage state plans, you get vision, hearing, dental. If you opt out and buy these private insurance, Plan F or some such, you don't get it. We think the state will continue with the dental. Right now, dental is a separate line on your benefit. Right now, hearing and vision are included in the Cigna plan. That's what you will lose and have to repurchase.
This booklet that I got says dental coverage will continue at a separate premium. Ma'am?
Okay, my name is Betty Bedina, and I'm retired from the Benefit Center here on campus. And you're doing a fine job of explaining Medicare, but the thing that people don't, I think you're getting everybody excited about it, but you know, there are Medicare Advantage plans that are being offered by the state. Are you going to speak to those?
Yes.
Because I think you should do that before you go into, if everybody decides they don't want to have those Medicare Advantage plans, because it looks to me like the PPO plan offers very good coverage, comparable to what we've had. With a bigger out-of-pocket, okay, a bigger out-of-pocket. There are many people here now that are in an HMO. They might like to stay in an HMO, and all this stuff about Medicare and whether you're going to take Plan F and what you're going to lose if you take Medicare and $300 a month extra it's going to cost you.
You know, it's funny you brought that up, because I'm just going to go on to Medicare Part C. It's like I planted this question.
Okay, but, you know, I mean, I think you really need to speak to what the state is offering. Okay, but, you know, you need to know. All right.
Let's talk about Medicare Part C. Historically, Part C is the managed care component of Medicare. Again, it was put into place in '97 because of the growing attractiveness of the managed care plans. There are two models of healthcare. There's the fee-for-service model and there's the managed care model. Fee-for-service is when a provider provides a service, they get a fee. If they provide 10 services, they get 10 fees. If they provide no service, they get no fees. So the incentive in the fee-for-service model is to provide services. For those of us who are in traditional Medicare, that's the way the system works. It's a fee-for-service model, unfortunately. In the Medicare Advantage managed care, the incentives are different. There is an incentive to keep people healthy and not to use services, and in some cases to pay less for those services, to manage within the revenue stream that's coming into the managed care entity. Within the managed care umbrella, there's two types: health maintenance organizations, HMO, and preferred provider organizations, PPOs. Now, and that's your choices, as I see it, that are in the plans being proposed. And in this HMO, it's going to be a closed network. You have to stay within the network, or else you'll be liable for the charges, unless it's an emergency. You have to get assigned a primary care physician, a PCP, and that physician will then direct any of your care within the HMO system. Now, if you're off visiting the grandkids in Arizona and you have an accident, you have an emergency, and you go to the hospital through the ER, the plan's going to cover it. If it's not an emergency, the plan will not cover those charges. You'll be responsible for the full charges. Sir?
What if you had an emergency in Canada? Not Arizona, but Canada.
This, it may not cover it. I know one of the issues, one of the other things that traditional Medicare does not cover is foreign travel.
Right.
So that may be the same case here. Again, an emergency, yes, it's covered. I'm sure if that happens, you're going to get into a debate with the plan about what constitutes an emergency.
It has a PPO, we'll cover that. So there's a PPO advantage plan. This is I'm an HMO. I'm looking for service.
Yes, I was just going to describe the PPO next. The PPO does not restrict you to stay within the network. You can go to anyone, any provider, as long as they accept Medicare. Now, to this lady's point, I too, when I read through this booklet, the PPO looks pretty good. You know, in fact, it's the lowest cost. It has the lowest out-of-pocket cost, $1,300 a year. It's going to cover any physician, any provider who accepts Medicare. They're going to pay whatever the Medicare approved amount is. It looks, I mean, it looks good. Apparently, there's some issues with it, though. Now, to get to this other point that this lady brought up, is that there is also within Medicare a physician or a provider, that's physician, therapist, hospital. They either can participate in Medicare or not participate in Medicare. If they participate in Medicare, that means they will accept the Medicare approved amount as payment in full for service. and they will bill Medicare, and Medicare will pay the physician, the hospital directly. So, participating provider, accepting assignment. Now, a provider may also elect not to participate in Medicare. And if they elect not to participate, then they can either accept assignment or on a case-by-case basis, or not accept assignment. And if they don't accept assignment, what happens is that they will bill you, and they can bill you no more than 15% above the approved amount. You have to pay the physician. You have to then bill Medicare to get reimbursed from Medicare. So,
You said the last time they won't bill you more than 30%. Can you say that again?
yes. There is the maximum, again, if they don't accept assignment. Let me explain it by an example. You go to your doctor, and the doctor's charge for an office visit is $150. The Medicare approved amount is $80. If they accept assignment, that means they will accept the $80 as payment in full. They will bill Medicare. They, the physician, will bill Medicare. It's Part B. Medicare will pay 80% or $64. The patient's going to pay the 20% or the $16. But they will accept the $80 as payment in full. If they don't accept assignment, in fact, we have a physician, our family physician, our PCP is in New York City, and we've been going to him for 20 years. We love the guy, but he doesn't accept assignment. So when we go to an office visit, we have to pay then and there what the charge would be. He actually submits the paperwork to Medicare, and Medicare pays me the reimbursement. Now, remember, $80 is the Medicare approved. So, but he can bill what's called an excess charge of up to 15% of the Medicare approved amount. So the Medicare approved amount is $80. 15% is $12. So he can bill me that $12 plus my 20% coinsurance. So when you are talking to your doctors and the providers, you need to ask, do you participate in Medicare or not? If they participate in Medicare, they accept assignment. If they don't participate, you then have to ask them, will you accept assignment for me? So those are the two questions. Ma'am?
So is it a difference if they participate in Medicare, traditional Medicare, could they say, but I don't participate in Medicare Advantage? Do they have the option of saying that?
Yes.
Okay.
And what are the other sources of that?
Could you repeat it for people? I don't know if everybody heard.
Can a provider opt to not participate in Medicare Advantage? And the answer is yes, but it's through a different mechanism, and I'll get into that. But yes, they can opt not to participate. Ma'am?
Right now, and maybe this is changing, if a provider says, I don't accept Medicare, but I'm going to give you pay, and then you do the paperwork.
Right.
Is that going to be the same?
Yes.
And it's not that easy to do.
No, it's not. You know, it's not. Ma'am?
If the provider takes Medicare standard, but not Medicare C, and you go to that provider, and that provider is going to bill you because you're on C, what are they going to bill you? Are they going to bill you the Medicare rate plus an optional 15% or some other amount?
Okay, what will be the relationship between the provider and the Medicare Advantage plan that you're looking at? Unfortunately, there's a long-winded answer to that question. But what happens is the Medicare Advantage plan, the plans and the four that are being proposed, are in effect separate insurance companies. So those HMOs, PPOs, enter into a contract with physicians and hospitals, an actual contractual relationship. And as a part of that contract negotiation, they will say, we're going to provide you the Medicaid, we will pay the Medicare approved amount, and we'll pay within 30 days, et cetera. And then the physician and the provider has the option of signing it or not signing the contract. If they don't sign the contract, then they don't have a relationship with that plan. So then what would happen if you go to that provider who doesn't have a contract with, let's say, either of them at this point, let's say the HMO, you could be subject to paying that $150 charge, not the $80. So there's the risk. Now, in all of my career, I have never seen a hospital not accept Medicare. Now, there obviously may be some exceptions here in Chicago as we speak, but I'm just telling you, I've never seen it.
Yeah, but they'll accept Medicare, but at what price is the issue?
I'm sorry?
They'll accept you as a patient, but what are they going to bill you, which you're responsible for?
If you're on the Advantage plan.
If you're on the Advantage plan. Well, again, remember, there's two different plans, the PPO and the HMO.
I'm talking about the PPO.
The PPO. Well, then the PPO, they say they're going to pay the hospital whatever the Medicare approved amount is. If I'm a hospital CFO, I'm taking those patients all day long. I mean, it's no different than traditional Medicare.
But am I, a person on C, going to have to pay the difference between
No.
the $80 and the $150 that the provider?
No, because they will, if they have a,
But if they don't have a contract?
if they don't have a contract, then yes, you risk the run of paying the $150. Yes.
If you don't.
How do we find out whether our doctor is going to sign this contract with the plan when the plan doesn't even exist yet?
You have to ask the doctor's office. One, do you participate in Medicare? Yes or no? If it's yes, you're done. That's a good thing. If they say, no, I don't participate in Medicare, then you have to ask them, will you accept assignment on my behalf, me personally?
But if the doctor, I know my doctor accepts Medicare, the regular Medicare, but is he or she going to accept this new state plan of Advantage, new Medicare Advantage plan that the state is offering?
If I'm your physician and the PPO comes to me and says, let's enter into a contract and I'll pay you the Medicare approved amount, I would sign that contract. Now, whether your physician signs it or not, I don't know. It wouldn't be in their interest not to sign it, is my point.
No, but if they said Medicare, but not Medicare Advantage,
I'm talking Medicare Advantage.
Well, we have to sign up for this before the middle of December, and our doctor doesn't even know about this.
I know, let me step back for a minute and repeat. The PPO, Medicare Advantage plan, the PPO plan, they say in here, they're going to pay the Medicare approved charge. So, the PPO comes to me, Dr. Baran, would you sign a contract with me to provide services to our patients? We'll pay the Medicare approved amount. I'm signing it because it's in my interest to do it. I don't understand why they wouldn't sign it.
I talked to my doctor.
Yes.
My doc accepts Medicare, but not Medicare Advantage.
Medicare Advantage, HMO and PPO?
PPO. Right, just PPO.
He doesn't accept
My
PPO.
doc says, will not accept Advantage, Part C. They just don't want to get most of the paperwork.
There was a mic.
Is there a mic?
Right over here.
Standard
Suggest a reason that they wouldn't want to take the Advantage plans. With standard Medicare, there's one agency to work with. With the Advantage plans, there's multiple agencies. So they start accepting Advantage plans. They might have 20, 30 different plans they have to deal with, and that costs them money to deal with all these different vendors. So it's...
I understand that, but at the same time, all of these providers are looking for volume. They're looking for the services. Services just equal revenue. No services, no revenue. I can sort of understand the HMO piece of the Medicare Advantage. That historically has always had some issues. Quite frankly, today, November 4th, I hear what you're saying, but it just doesn't make any sense to me on the PPO.
It may not make sense, but it's a fact. Northwestern Memorial Hospital and the Northwestern Physicians Group do not accept Advantage plans. They do not accept United Healthcare Advantage plan. So PPO or not, logical or not, they do not accept it. This is a fact.
I know that. I know that. But here's my other point, and I printed out the thing from the Northwestern website. Northwestern Memorial participates in a variety of insurance plans. We accept traditional Medicare and Medicaid insurance plans. However, we do not participate in any Medicare or Medicaid managed care, parens, HMO, and parens plans. So I'm saying, wait, just hold on, just a minute. It's confusing. You would think they would say both HMO and PPO. Here's how to get this thing resolved. And Brenda and I were having this discussion earlier. The only way to resolve this is there's got to be a senior level person at CMS who has the answer to this question. It's not a difficult question. There's got to be someone there who can say, yes, they do accept the PPO. No, they don't accept the HMO. No, they don't accept the PPO. It's not a difficult question.
On that same web page, it also says we accept no Medicare Advantage plans, period.
Right.
On the same web page, and I called them up and I talked to them. And they gave me some senior supervisor to talk to because I was persistent. And she said, no, they do not accept Advantage plans, period.
John?
So, sir, back here.
You know, we're getting into fine details here. I have a basic question. I have Medicare Part A and B that I pay to the federal government. The state provides me with the managed carriers.
Yeah.
If I choose to stay with the federal Part A and B, next year I lose the state support for that managed care.
Yes.
There's supposed to be some $500 fund, but that's federal money that can go away at the drop of a hat.
It's already gone.
Yeah, it's gone at the drop of a hat. So if we do not choose an Advantage plan offered by the state, we will not get any supplemental payments or monies to take care of that by ourselves out of pocket.
Right, yes, correct.
Yes.
Okay, that's because now when you say MA, I know I'm forced into it. Otherwise, I lose that managed care. Unless I pick it up out of pocket.
Right now, if, let's say I go to Dr. A, I get something from Cigna that says Cigna paid, that Medicare paid X, Cigna paid Y, and up until recently, I didn't pay anything. Now I pay 1% of something. So the question is, if we go into the PPO, will that be similar? That is to say, will I end up paying only that 1% of something?
No.
And who's paying then the part that Cigna pays now? Or am I going to pay that too?
As I read this document, Total Retiree Advantage Illinois, your trail to better health.
None of us have that document. It's on the website.
It's on the website.
Oh, yes. I think it does too.
This was on.
Okay, if you belonged to SUAA and you were a member, if you were a SUAA member, you would have been getting mini briefings and links. Okay? Please join, that's the pitch. If you join when you leave, I don't know if everybody has email, but we can send you these links again. Or you can go to the CMS website and find it. It's a public document.
It's called Total Retiree Advantage Illinois, your trail to better health.
It's misspelled as trial in some places. I see we have a lot of questions. At the beginning, Mr. Baran said he had 3 things he wanted to cover. And one is the information about guarantee. Now, I understand many of the questions you're asking are ones to do with the state Medicare Advantage plans that you will get free for yourself and then pay for your dependent. And we want to be able to answer those. It's not, someone talks, of course it's not free, you're paying 1% of your pension now, next July it'll be 2%. That's still much cheaper for most everybody than going outside the state plan and buying these Plan F from Medigap and private insurer. I mean, it's still cheaper. But I'm looking at the time here, and I do want Mr. Baran to talk about the guarantees. I think we're getting into some of the details. The problem with the details about doctors and hospitals, and many of the cards that people have handed in about that, is that CMS, I don't know why, but they still haven't posted those policy plans that are the kind that if you go to an insurance broker, they say, where's the plan? Specifically what's covered. CMS knows that, they haven't revealed it. Likewise with drugs, we're getting a lot of questions. Is this drug coming on right now? My wife has cancer, very expensive chemo. Her oncologist is persuaded, you know, Medicare, HMO Illinois to cover it. What will happen in the future? Those kinds of things we can't answer. They still don't have the drug formulary up on for the Medicare Advantage HMO or PPO plans. You can't choose if you don't have the information that's personalized to you.
But let me just go to this gentleman's question back here, though. Again, the Cigna plan is gone. If you're in the state Medicare Advantage plan, the PPO, you're going to pay on every service 10%.
He just scared heck.
The plan will pay 90%, you're going to pay 10% after an initial deductible of $100. So your first $100 is yours, and everything after that is 10%, up to a maximum out-of-pocket cost of $1,300.
The Medicare.
Year, per year.
There have been two announcements of that, one of which says 10%, the other says 20%.
That's the other plan, the SIP and the TRIP plan.
Oh, okay.
Let me go back to the three questions I started with.
Here's my question, pretty simple. The new state advantage plan, $100 deductible, sounds too good to be true. Does that mean that it replaces the A and B deductibles too, or do we still have to pay those?
It replaces it. Remember, does it replace the Part B deductible?
I'm going to have someone come around and pick up questions.
Where's the mic over here? Right here. This lady right here.
Yeah. Questions? All right. He's got one. Questions? The new plan being sponsored by the state, the United PPO, the deductible is $100.
Yes.
Which is amazingly low, and I thought it was too good to be true. So, my question is, if we cover that deductible out of our pockets, like we're supposed to, does that also replace the Part A and Part B Medicare deductibles? We don't have to worry about those anymore?
Yes.
No, we have to pay the Part B premium.
Not the deductible.
But not the deductible.
That's correct.
And not the copay, and not the this or that.
Remember, the Medicare Advantage plan combines A, B, supplement B.
Okay, fine.
The deductibles are a little larger under the HMO. But let me go back to my initial three questions. Remember, what's going to be the cost if I go into traditional Medicare? That's going to be about $300 a month per person. What about the guarantee issue if I leave the state and I go into traditional Medicare with a supplement? And three, how about the issue with providers? Well, we see that there's no clear answer, or in some places there's a clear answer that providers are not going to accept the Medicare Advantage plans. In my head, it's still a little clear. Again, somebody at CMS, a senior level person, can answer that question. They can answer it today. It's not that difficult a question. Now, question two, what if I'm going to switch in and I'm going to get out of the state plan and go to traditional Medicare? When a person turns outside the state, me, when I turned 65, I signed up for Part A, Part B. When you do that, you have a 6-month period to sign up for a Medicare supplement plan. During that 6-month period, you are guaranteed to be accepted with no issue with pre-existing conditions, claim history, or anything. Guaranteed, if you do it within 6 months. So the question has become, what happens to you folks if you leave the state plan and go into traditional Medicare with a supplement? The news is not good. Yeah, and again, this is another one that just doesn't make any sense to me, but this is the answer that I've got. Let me just read you the words. The question I asked was, is this still true under the Affordable Care Act? I thought pre-existing conditions were eliminated. Wouldn't this also apply to Medicare supplement? John? The answer that I received this morning, supplement policies are not health insurance coverage. It is a policy to assist in covering what Medicare does not cover, so the ACA has no effect on it. pre-existing conditions still apply to the supplements. But you are correct on health plan, pre-existing conditions no longer apply under ACA effective January 1st. So, and this is a paid employee of the SHIP program as part of the Department of Aging. She said, you're not guaranteed issue. Ma'am.
Yes.
Mike?
There's a question here with the young lady with the mic. I'll bring the mic over to you.
I have information.
I'll bring the mic over to you, okay? Good.
Hi, John. I actually two things.
Yes.
First of all, I would like to address the gentleman over there about the PPO HMO. I can clarify to you this. HMO and PPO in regular health insurance. HMO and PPO in regular health insurance, if you are employed, is different than HMO, PPO, Medicare insurance. So, if a hospital says they accept PPO or a doctor, you have to clarify if they take the Medicare Advantage PPO, because they indeed may take PPO, but it may not be in a Medicare Advantage plan. That I can absolutely positively clarify. You need to talk with your doctor. So even if you call a doctor and they say, we take PPO, it does not mean that they take Medicare PPO or HMO PPO. Number two, I just have a question for you, sir, or I'm not sure who would answer this. On the Medicare Advantage plans in the state of Illinois plan, apparently there's a 1% charge, which it does say on that document that you have, the trail. The question is that 1% is of the annuity. Everybody gets a different annuity.
Right.
So what I want to clarify is that 1% then charge, if somebody gets involved in the Medicare Advantage plan, apparently would be different for each individual. Is that correct?
Yes.
Okay. Secondly, if somebody had, like this couple here, the member is one person and she has a spouse who is 65 or older, and apparently there's a charge. And that charge is what?
$110.
It's in the guide.
It's on the document.
So is it $110?
For the PPO.
I don't know.
Okay.
Okay, it's another one of we don't know, but from hearings we've been going to and information we've been receiving, Janice Bonneville, who's the executive director of CMS, is on the hearings to the legislature, saying that no one will pay more than the full coverage the state is paying for these Medicare Advantage plans, which is $180 per person.
So you're saying the
So I don't know if they're going to deduct the 1% from two retirees who are married to each other, or whether they'll deduct it from one and you pay the dependent charge for the other. You should figure it out. Some people in the super high executive pension area would be paying more than 180 at 1%. And they say they won't charge them more than they're actually paying for the provider.
So if somebody gets the Medicare Advantage plan and their pension is $5,000 a month, 1% is $50. Okay, so they have to pay $50 for that Medicare Advantage plan, correct?
Correct.
What is the state paying them?
The difference.
What difference?
Between what the insurance company charges and
The state will be paying a capitated amount, a capitation rate.
So everybody has, the bottom line, everyone has a fee if they involve themselves in the Medicare Advantage plan.
Yes.
There's a twist on this, which I don't think you can answer, but it ought to be known. My wife, who has 9 years in the system, signed a provision under SB 211 that she would not be charged more than for her health care. She now pays 1% of her pension for health care, but according to the table, she would now pay something like $85 But I want to know whether this SB 211 still holds. Because that makes a big difference in the terms of the cost.
It's pending in the courts right now.
Question here?
Yeah, I just wanted to respond to the issue of guarantee issue. I asked the woman who's at SURS, who is manager of insurance, and I asked her, if I leave the plan, I'll get a letter of termination. Will it say I was dropped, or will it say I chose to leave?
Chose to leave.
If I'm dropped, my understanding is I get guarantee issue to get a Medicare policy. She asked this question of somebody at CMS. 2 days later, she called me back. She said, you'll get a letter saying you were dropped. Okay, if that's the case, I don't know if it's the case. If it's the case, then we get guarantee issue with the application with the Medicare policy. But I understand that this whole issue of guaranteed issue is with the Commissioner of Insurance of the state of Illinois. According to, this is the federal, your right to buy a Medicare policy. You have original Medicare and an employer group health plan that pays after Medicare pays, and that plan is ending. You have a guaranteed issue right. However, I spoke to a senior person at SHIP on Friday, and she said one of the problems now is that they are looking at the Illinois insurance law of 2012, and that reads quite differently. And I can't quote it right here, but I do have that, and I'll send it to you, Brenda, the actual law. It says something about it, you would get guaranteed issue if it ceases, something about this supplement, no, it's not. It's supplemental ceases entirely, or all supplemental benefits cease. It doesn't say end. And I've talked to people at CMS, and I've talked to people at SHIP, and this is where it is. Now, I don't know, does federal law override state law? This is really a very big issue, because we have until December the 7th to make a decision on Medicare D to get the drug plan. And also, if the plan ends, we have 63 days after the plan ends to get a Medicare policy. But if the plan doesn't end, I'm assuming we also only have until December 7th to get a Medicare policy. However, there are all these seminars around the state. The one at the Thompson Center is on December the 6th. I mean, come on. I'm ready, Tony, tell me not to say it, to barricade. He always says, do not put that in your emails. But this is the time. This needs an injunction.
Yeah, folks, you need to be calling your state senators and representatives.
They don't answer.
Absolutely.
They don't answer.
Even if they don't answer, send them emails, leave them voice messages. I'm in the district of Daniel Biss and Laura Fine, and they're both very activists in respect to health insurance. They both care a lot about what's happening. And I got an email over the weekend from Biss saying he can't get answers from CMS. Right? I mean, they're not giving us the information. But all of you contact everybody you know, Quinn's office, everyone. The CMS knows the answers. I mean, you said that. These policies have, these contracts have been agreed, the payment has been made. They know what's in these policies. They're not revealing the information, so we can't choose.
You know, and unfortunately, this specific question too, I guarantee, this is not a difficult question either. It's either yes we do or no we don't.
Do you want to remind people what it means to have guaranteed issue or not?
It means that you cannot be turned down for any pre-existing condition. They have to guarantee an issuance of policy for you. And once you're in, the policies are all guaranteed renewal. But it's the initial getting in is the
I
guarantee.
just want to make one other point. If it's this hard to get out now, it's going to be impossible to get out later. We guarantee it.
In my opinion, if it's this hard to get a promise of guarantee issue now because the state won't say it's dropping us, then it's going to be impossible later if you don't like this, the Medicare Advantage to get out.
Well, you know, I've heard this morning from a ship employee that the guarantee is not there.
Yeah, but that's, okay, so there are two things. One is Obamacare, and no pre-existing conditions for 65 and under. That's not there. We're asking about the second issue, which is if you're 65 and older in Medicare, and you're in a Plan F from company who, what, where, someone's complaining, and that company drops you, you can move to another company. That's a different issue. And what we're asking now is for verification that this dropping of the state Cigna plan is one of those qualifying conditions. We haven't been able to get assurance because what they can say is they're putting in a credible Medicare Advantage plan that we can all join. So it's a ruling that needs to come from the Illinois Insurance Commission to clarify this. For those of you who are really worried about Medicare Advantage, let me tell you this, in the state of Illinois, if you drop the state plan, Blue Cross Blue Shield and I believe Allied Health, both will take... Health Alliance, thank you. Without looking at pre-existing conditions. If you go to another insurance company like Aetna, they may have a restriction for pulmonary. If you go to, I'm making them up, I shouldn't be making the names up, Humana, da-da-da-da-da. Some will not take you if you've got cardiac conditions, some will not take you if you've got cancer. Now we lost the mic again.
Blue Cross Blue Shield and Health Alliance will take you without...
Blue Cross and Blue Shield will take you today and won't ask you any medical questions. But if you don't get out if you don't do that by December 7th, you will have passed the open enrollment window for this year, and you will have to wait until next fall unless the state rules on this guaranteed qualifying condition of dropping Cigna to put in the Medicare Advantage. And we don't have the ruling on that yet.
Judy?
I wonder if there's a way to find out from CMS before December 7th about the issue of what to do with providers. I've talked repeatedly to Northwestern and to Rush. They couldn't be more specific. They do not take the Illinois group-sponsored PPO plan. They simply do not. I called CMS, but I just talked to a staffer who said she didn't know, but she'd heard that. I called the plan administrator in Salt Lake City of United Health. The plan administrator simply said, your provider may not take Medicare Advantage. If that's the case, then you pay and we reimburse you, or you might negotiate with your provider. So all these people can't possibly be speaking for their organizations, but it doesn't look very good. And I'm wondering if somebody could, either from SUAA or SERS, could talk to CMS to get it clarified, or if it's a legal issue, that it can't be clarified. And thank you for working on it. It's a good reason to join SUAA.
I don't think it's a legal issue whatsoever. I think it's, and I'm sure, 99% sure, that the senior level person down at CMS knows the answer.
Why are they withholding information?
Because of, probably the backlash that, and, it's a serious issue. Question here. Yes, ma'am.
Hi, we could go back 2 minutes to regular Medicare. My question is, if I decide to, for whatever reason, to go to the Medicare Advantage plan and it doesn't work out, and I want to go back to the federal Medicare plan, will I have to pay a penalty for the rest of my life for opting out of federal and than going back into it.
I believe the answer is no.
Debbie? Okay, listen, there's a couple things that people, you know, you gotta get this paperwork and read it, because most of these questions are answered in here. Now, I got this off the internet because I am a member.
That's totally
There's lots of answers in here, okay? One of them is, yes, indeed, we will continue paying our 1% premium, okay? That's for the employee. If you have a dependent, there's a dependent premium, whatever it is, depending on which plan you take, you will continue paying that. And there's a chart in here that tells you that. Now, the man over here who said his wife had 9 years and she was his dependent, generally, if two of you are retired from the same system, you can't have that person on as your dependent, but that's an old reg. I've been retired for a while too. So I really want you to pay, you better read this. A lot of the stuff is very clear in here, and I don't think there's going to be an awful lot of people who want to drown. What is your question? Okay, there's a lot of these questions that are answered, and I think that a lot of you will want to take the Medicare Advantage plan or the PPO plan, and they will be a non-issue for you. I think a lot of you are very worried about this now, and worried about whether or not you can get into Medicare.
I think it's very interesting that I think CMS does not want people to leave because the system won't be viable for people, particularly people with high incomes.
I have a question here. Standard definition of
Well, there probably is. Is there a standard definition of what constitutes an emergency? I'm sure there is. I'm sure it's quite specific. I'm sure it would include if you had a heart attack and you're rushed to the hospital through the ER, or if you're in a car accident. But if you contract pneumonia or a, sinus infection, I'm sure those don't constitute emergencies. It's got to be, and I'm sure it's more precise than that. Well, I think. Go ahead. Oh, sure.
I just asked, we have 5 minutes more. Mr. Baran said sure he could stay longer, and no one's seeming to be throwing us out of the room, and we've got lots of questions, so we're willing to continue if you are.
Question on that.
Yes.
Okay, in a situation where, for example, at Northwestern, they do not accept an Advantage plan, the alternative is to pay up front by yourself and then be reimbursed by the Advantage plan. What is not clear is how much you would be reimbursed, because in the trail booklet, UHC, for example, says they pay at the Medicare rate. But if you go to the doctor and pay by yourself and you're no longer in Medicare, you might be charged a higher rate, a non-Medicare rate. So what is a UHC going to reimburse you? The Medicare rate or what you paid? I called UHC and they said, oh, we'll pay you what you paid. But that is not what it says in the trail booklet. And so I'm wondering, is there some kind of guarantee that they will reimburse you according to what you pay, not the Medicare rate?
No, I don't think so. And here's the other problem. That might be okay with a doctor visit for $150. But what if you go in the hospital with a heart attack and you're there 5, 6, 7 days and the total bill is $9,000? So my point is, they want to pay that out of your checking account or put it on your Visa and then wait for reimbursement? No.
I'm going to interrupt, hello, friendly face. A lot of the cards that are being passed in, not to do with the topics that are coming up, but I do want to address them. If you or your dependent are under 65, this doesn't apply to you. You keep your Cigna, you wait till the next benefit period next summer, and then you see what the plans are, and you choose the way you've been doing. Doesn't affect you. It also does not affect those who are over 65, but either they or their dependent is not on Part B. It also, these things do not apply to you. So again, it applies to people where you and all your dependents are Medicare eligible, currently paying A and B, or will be before January when these new things click in. Okay? So some of you can go, oh, by the way, if you live out of the country, you're also okay. Some people might emigrate. And then you keep saying,
I have a question about the payment of claims. One of the problems with our Cigna coverage has been that, the state is so far behind in paying claims. So Cigna tells us how much is going to be covered by our supplemental insurance, but we never know when that's going to be paid, and it's frequently a year to a year and a half after it's due. And so I'm wondering who's handling the payments for these new plans, and is the state just as likely to be that far behind?
I can speak to that. It's very clear that the plans will make payments to the providers. The state will no longer be responsible for payments. Hooray.
But that doesn't mean the plans to manage their own cash flow will slow down payments to providers. That might be the other issue, why the Rushes and the Northwesterns don't accept the Medicare supplement, because the plans are slow pay.
There's a question here.
The chapter presidents recommended HMO Illinois, which is fine, that's what I'm in right now, except I understand we don't get to keep it. Blue Cross Blue Shield, HMO Illinois.
No, Blue Cross Blue Shield is not in the state plan. I'm just saying. Well,
okay. I see. Now, how
was.
Yeah, I understand. How does one access? How do you do that?
You opt
as an
out
individual?
on the forms that will be mailed November 12th. You will have less than a month to decide what you're going to do for your health insurance for the rest of your life. This is unacceptable. And we still don't have the information about the policies posted in a searchable way. And we can't get the information from CMS, from our politicians, from SHIP. We can't get the information. SUAA, Linda Brookhart, our director, has tried very hard. We cannot get the information. Yet, if you're happy with Medicare Advantage, and I think most people probably will stay with HMO if they're in state and relatively healthy and happy with who's on the plan when they finally see it. That's going to be your cheapest option, and it may work fine for you. The next, if you're out of state travel or want to pick your own doctor or keep your doctor, you're going with the United Healthcare PPO. UIC Hospital will take the PPO. I checked on that one. At least it's on the website. UIC Hospital, as it stands today, is not taking the Medicare Advantage HMO. I'm trying to pressure them to take it, at least consider it. Partly, and then Rush, Loyola, Northwestern, University of Chicago are saying they don't take Medicare Advantage plans, but we don't know that they can't be persuaded.
I have a very specific question. So I'm looking at the website of a physician's group.
I heard that they do not all pay the same amount as your school's Medicare amount. Do you know anything about that? Some of them pay less.
On the supplement plans, ma'am?
Yes.
Remember, all they're paying is the deductibles and co-insurance. After Medicare gets through paying, they just pay those three components. So if you go in for a hospital stay, the deductible's $1,184, they will pay that $1,184.
And nowhere in the literature I've seen so far, I think they right now, we have the
Yeah.
Repeat the question, please. Couldn't hear that.
The question is mental health and psychiatric coverage. We need to see these detailed plans that have not yet been released. I've also been asked about dialysis. I've been asked about chemotherapy of particular kinds. We can't answer because we don't have the information.
Question here? Yeah, so I just have a question about this, how providers react. So I'm looking at the website of an internship, there was a group of doctors here, and they have participating products and a list of companies, and then under that, and then non-contracted products. And so, for example, for United Healthcare, there is a participating product which is something that, like this lady said before, that for people who are working. Then all the Medicare things, either supplement or an Advantage plan, are listed as non-contracting. What does that word mean, non-contracting? What does that word mean? I hope.
That means that managed care plan doesn't have a contract with the provider.
But it's up here meaning that they do accept, or, I mean, this is, the fact that they list it must mean something more positive than that, right? That's what I'm trying to ascertain.
I just don't know.
I thought this might be a fairly common practice.
I wanted to go back to your, the three questions.
Yes.
And the first one, I'm still unclear about. If you leave the state system, and you want to stay in the federal Medicare program,
right,
and then you went on your own to get, your supplement, then you wouldn't have to pay your 1% or 2%, so you could apply that. Could you give me an idea of the cost difference, just generally?
Yes. Basically, she's asking, what's the difference? The difference in cost if I opt out and go with traditional Medicare, supplement Part D, as opposed to staying in. Here's what it is. If you opt out
Of the state system.
of the state system, you go with traditional Medicare, A, B, Sup, and Part D. Like I said earlier, it's about $300 a month, which includes Part D. Yeah. Wait a minute. Part A, the total cost of A, B, C, Part A, B, supplement insurance, and D is about $300 a month. The comparable cost, if you stay in the state system, you go with one of the Medicare Advantage plans, you will still be paying the $105, the Part B premium. You will also be paying, and I just use, if your retirement payment is $35,000 a year, I just picked a number. And if you go past the first year and you look at the 2%, that's $700 a year or $58 per month. So the cost staying within the system through one of the Medicare Advantage will be about $160 a month compared to $300 a month. So an incremental amount of about $120, $125. Now, let me complicate it. So that's the initial out-of-pocket cost. If you have traditional Medicare with a Plan F supplement, then you don't have any exposure to deductibles and co-insurance and co-pays. If you stay in the state system, you go with the PPO, if you have a really bad year, you're going to face a maximum of $1,300 of additional amount in deductibles and co-insurance and co-pays. But that's if you have a bad year.
Question here.
But I think there's a lady here with,
He has the first. He has the mic first, then her.
okay, go ahead.
So regarding this question of whether or not the PPO accepted or not, I just wanted, this specific PPO is described as a passive plan,
Yes.
which allows you to be out of medical. Is that common? Is it possible that the hospital administrators are not responding about that kind of plan?
Yes, it's possible. That's why, in my head, there's a disconnect. His question was, could the hospital administrators be misinterpreting what this PPO plan is and what it pays? And that's possible. That's why that senior level person at CMS has to speak to a senior level person at Rush, at Northwestern, at the hospital, not the director of billing or the superintendent of insurance, the top level person. Because I was a hospital CFO, a little tiny hospital, but we took Medicare. Would love Medicare patients, and if there was a payer out there that's going to pay the Medicare rate, come on in, we love you. So, to your point, there's just a disconnect that I have. I just don't understand why the hospitals are backing off the state Medicare Advantage PPO plan.
Well, let me see if I can answer that question. This is Chuck Stanislaw. I was the CFO of the medical center here. The issue is not the question of whether or not the hospitals are going to accept them, those 4 plans. The issue with the hospital is how they're going to be paid and whether their costs are going to be covered. Now, I can tell you that I called about and I think several of us have called about the United PPO. That right now is an issue for the hospital, although I think politically, I think the hospital will accept the United Healthcare PPO. It's the only state hospital in the state. So I do not believe that the hospital will forego the United HMO or the other 3 plans. Now, the other 3 plans, believe it or not, when I talk to the people that handle it over here at the medical center, they're better payers than the United Healthcare. So the Aetna and the 2 HMOs, the Humana, seem to be better payers. But I will tell you, I think politically, the United Healthcare PPO, as well as the others, are going to be accepted. I also think, well, let me tell you, I think Northwestern and University of Chicago and Rush and all the others are going to follow suit. There's just too many people out there, too many teachers in the Northwestern cycle. So there's going to be enough pressure on all 4 of those plans to be accepted by everybody. Now, I can't guarantee that to you, but I will tell you that that's probably what's in the works right now. So I think that's what's going to eventually happen, because politically they will not sustain and be able to stay within the system, within the city.
But just to follow up on that, and thank you for those comments, my point is, it's not a political issue. If those hospitals are going to accept a Medicare patient from Blue Cross, or anybody, or why not accept the UIC PPO patients? They're going to pay the Medicare approved amount anyway. I mean, again, that's the disconnect that I have, that it just doesn't make sense. The HMO, I can understand, because usually they're trying to pay less than what Medicare pays. That I can understand.
But the point is that we've got, this is all nonsense. We've got 1 month to make a decision. We're talking about some crazy blue sky politics where somebody might do something that, if they do make a decision X, we'll do decision Y. How are we going to know definitively whether or not these hospitals, it's very disturbing, because my wife and I go to Rush for everybody, and we don't want to leave. And to say, we don't know, maybe they'll do it, maybe they won't. When, December 8th they'll decide? That's really a big problem. When is somebody going to say definitively they will or they won't?
Yes, that's a huge problem.
Just a comment on that. Remember, I agree with you. but the state of Illinois and the politics, unfortunately, in this state are a little bit different. So I would think that a decision will be made. It will probably be made very shortly. But CMS is trying to get their act together. They got a whole carousel of presentations that they've been made throughout the state, and I think they're still confused on what's going to happen. So while there may be a little bit of a patience that we need to have, although it may be a little bit curved, I think that we need to just let the plans roll out, and I am sure that something will happen.
But here, I think they already know. How could you possibly be designing this new plan and not have answers to these basic questions? Again, these are not complicated questions.
Hello. If I take one of these Advantage plans, what happens to my spouse, my wife? What kind of coverage would she have, and what would her cost be?
There is, two would be covered in the Advantage plan, and there'd be an additional cost of $110 a month for your spouse.
I just want to clarify one thing. Maybe you've already clarified it, but under the plans you went through, federal plans, under some of them, if they don't tell us, and I want to make sure that I'm covered by brush, I can find one of those plans that will cover me by brush. Right? Like this, let's say Humana continues to be one of the plans in the federal Medicare. Can I find one that covers brush?
You're talking about the Medigap insurance?
Yes.
Yes. Yes, well, then it's not an issue. If a provider accepts Medicare, they love it when you have a supplement plan, because that means there's more cash coming in the door. So yes, it's covered.
So you already gave us the price of the Medicare, right?
Yes.
And it wasn't outrageous.
Plan F is about $155 a month. Per person. That's an age 65. Yes. The more you pay. Let me, the gentleman is absolutely correct. That $1,900 a year is Plan F, age 65. It goes up age 70, 75, etc. So again, it's age 65. But there's a 30-page booklet that gives all the insurance companies. Yes.
Yes, since this issue is so confusing for everybody, I'm just thinking that, is there some kind of way that this could be halted, that they could stop them from doing it, and you can have more time for everybody to learn everything, you can get more people at the table, the ones you're talking about, CMS and all the top to give the right information. This is crazy.
I agree with you. That obviously is a political issue. I mean, I don't think, it's November 4th. The window for you folks to make a decision is very short. And again, when CMS puts on these road shows, they're going to get these exact same questions. But they got to give an answer. You can't, what's the...
I have just a couple of questions before we comment. One thing from the SUAA mini briefing back when 8:30 said about one of the reasons why Northwestern Road whatever don't want these plans is that it says in fact claims will continue to be at least 40 weeks in arrears during the foreseeable future. That out of state could be even longer, and that's one thing too. If you travel much, how do you know whether your Advantage plan will be covered anyway.
That's the point. The issue with the PPO plan may be because they're slow pay. I mean, 40 weeks is 10 months. Nobody wants to wait 10 months to get paid for anything. So that might be the issue. And secondly, if you stay with the plan and you're a snowbird to go to Florida for 2 months, the HMO is too risky. Because, too risky.
Question. Let me see if I can throw a monkey wrench into this. Brenda, in part, answered my question, but it's interesting. Here we have a whole bunch of people who've been employed by a state organization and who haven't been eligible for Social Security, let alone Medicare, and 99% of the discussion here is what part of Medicare do you want to consider and so forth. Well, I want to raise a slightly different one. I haven't piled up enough quarters. I'm well past 65. So I have Medicare A through my spouse. She is AB, and I keep her on the state as a supplement, and my insurance is through Cigna. But now the question is, should I consider paying for B so that I can move into one of these multiple Advantage plans? And if so, I mean, how does that apply to a whole bunch of people who I'm sure are in this room, or at least former employees of the state in one way or another?
Everybody has to make their own choice. I checked on the numbers of people over 65 who are in SUAA, which is the SURS retirees. There are 3,400 that are in your category. There are many, many, many times that have paid in Medicare. Current employees pay into Medicare and have been for how many years? 15 years or something like that. So it's an important group. David, you're lucky. This doesn't affect you. You can stay as you are. I see no reason that someone under 65 or exempt would be agonizing over what the quality of the Medicare Advantage plans will be. You keep Cigna.
Well, what would it cost to add B?
Okay, those are numbers. It's means tested. If you're earning $85,000 or less for a single, or $170,000 for a couple, it's the $105 that Mr. Baran's being quoted. If you're in a higher tax bracket, it goes up. It's sort of 100, 200, 300. But that doesn't, I mean, most of our retirees are not in those high brackets. They're in the 105 a month for Part B.
I've requested from CMS, and I have a statement for both of us, my wife and I, that we are going to continue in Cigna, et cetera, et cetera. But what is happening after June 30th of next year seems quite uncertain. Do you have anything that you might project as to what the changes might be in healthcare options?
I am looking at my crystal ball. As I understand it, the people in that category essentially get what current employees get. There will be a plan. I don't know what it will be. I think we're getting ready to wrap up. There are a lot of people who put questions on cards. We've got them. I think many of those were addressed with the mic, but I have the cards, and so I don't know, I'm not going to promise to put up a frequently asked question because we don't have the answers. I have some points of information to give you. If you get a pen, I'm going to give you a website and telephone number. In order to keep in touch with you, please become a member. Pending waiting for that, please leave an email address and your name and an email address so that we can keep you informed. Okay, the numbers, the CMS helpline, good luck, 800-442-1300. The booklet, the Trails booklet, www.cms.illinois.gov/ www.cns.gov/the-trail, T-R-A-I-L. www.cns.illinois.gov/the-trail. That page. Forward slash. The trail is all one word. The phone number again, 800-442-1300. That's CMS.
Will the trail be mailed?
We don't know what's coming in the mail from CMS November 12th. In any case, most of us haven't got the card yet, and the mailing seems to be coming in a spotty way. They're mailing 128,000 pieces of mail to retired teachers, community college and university employees, and it covers another about 100,000 dependents. So this is affecting 250,000 or so people. And the mailings are dribbling out. I want to say one thing to be sure you all know. If you think by now that you should be covered on this, if you did not get that yellow letter, it means CMS doesn't have your right address. Also, everybody is supposed to be recertifying their dependents. And we didn't mention that today. To do that, you had to get the transcript from the government and file something and da-da-da-da-da-da-da-da. Okay. If you're tech savvy, please do it on the internet. It gives you an immediate feedback. And if you're not sure you did it right, there's a helpline right in there, and the people are very, very helpful. And you can find, they can look at what you uploaded, if you scan your documents, and then they can say, no, I mean, like I remarried and I don't have the same name as my spouse. So some of the financial stuff looks like we're not married.
For that dependency qualifier, you're saying that when I go to get the transcript through the website, they're going to send that to you or whoever doing Medicare?
You have to get the transcript.
Oh,
I can't go into the details of this. No, it comes electronically.
You know, I've sent in my tax form, and they said, no, I got to go do this.
The tax form doesn't count. You have to get the transcript because you could be faking something you send in. You have to get a transcript. In the transcript, you only have to send them the very top little block of the first page that has your name. Actually, they don't look at the names. They look at the social security numbers and track that that's on the dependent form.
But it's already been a couple of weeks that I've asked for that, and I have...
Okay, again, if you do it on the website, then you can go and check if it's processed through and it'll say confirmed. Mine is confirmed. Well, yours isn't. This is another mess.
I just want to give you an email address or two so that, please write this down. You don't have to write a piece of paper your questions and then turn them in now, but please write down the following two email addresses, and I will be sure as webmaster, my name is Merrill Gassman, I will be sure that the questions go to the appropriate people, either Brenda or to the Springfield office of SUAA. The first is SUAA@uic.edu. Very easy. That'll come to me and that'll go to Brenda. The second email address is SUAA@suaa.org, O-R-G. And that will go to the Springfield office of SUAA. Please, I would advise you, use the first email address. If we here in our chapter, our board, can't answer your question, we will forward it to Springfield. We're going to do everything possible to answer everybody's questions and clarify this as best we can. The two addresses are SUAA@uic.edu, and the second one is SUAA@suaa.org.
And everybody
probably has gotten their Medicare handbook. There is so much information in there. And also, it will take you to find out what websites you go to get more.
I don't think you can hear, so let me repeat that. The other address, if you're thinking of moving out of the state plan and you want to know more about Medicare, they have a very user-friendly site, medicare.gov. And what's the one for drugs? It's in there.
It's in that website.
Inside that is the drugs, and if you're going to get a drug policy, you fill your cart like Amazon with the drugs that your prescriptions that you're taking, and it'll direct, and you put your zip code in so they know where you live, and it directs you to plans that will cover you. That website really works well.
You might remind people that, I mean, heretofore, we haven't been really doing a whole lot of research. We haven't been needing to do it. But going forward, I think you're going to have to get used to doing a whole lot more research on your own, because everything is just totally too complicated. So, I mean, start reading some of that information. You have some of those books and paying attention to things on the website.
You know, in each of your areas, call that SHIP number too. And wherever you live, there's probably a senior service center or a town hall that has SHIP volunteers you can meet face to face. So, ma'am, you got a question?
If you'd like to see representatives and senators, what's the most useful message you can send them?
Unfortunately, it's probably too late to write. I mean, it's November 4th. You've got to make a decision by December 13th, and you can't wait till the 13th now. December 7th. I think you got to call. And again, the two important questions are, am I not going to be guaranteed coverage if I go over to traditional Medicare with a sub plan? And what about providers not accepting the Medicare Advantage in Illinois? Those are the two questions. The two questions are, first, am I going to be guaranteed issue or not? If I go to traditional Medicare and try and get a supplement plan. And then secondly, if I stay in the plan, what's going on with these providers that we're hearing are not going to accept the Medicare Advantage plan?
I have one simple question. Is there any way in the current moment to find out whether one is accepted into a Medicare supplement plan other than finding one in the closet?
Yes, I think. And it's, again, someone, some group, some committee, got to get down to the Department of Aging and ask that specific question. And again, I believe people already have the answers to those questions. It may not just be publicized. But a face-to-face meeting with the senior level people at the Department of Aging.
So I can see people are finally getting hungry. They didn't eat early, living on yesterday's clock. This week, our politicians are down in Springfield for the veto session. They might also come up, they might consider the whole pension plan. Quinn wants them to. We hear that they'll dodge that and it won't come to a vote this week. Doesn't mean it's right. But they are in Springfield, so it's a very good time to be active today. Call their home offices, email them, and ask these questions, because they're taking these questions with them when they're down there. And the more different people push it, the more likely we are to get answers.
And I think when you call their offices, you got to be very aggressive. I mean, you got to say, this is an outrage. I've heard that Rush, Northwestern, aren't going to accept these plans. And you got to make it clear. Two things, an outrage and the urgency.
Question. Yes, if you decide, if you're kind of skittish about staying with it because you don't know what's going to be covered, and you opt out and do a personal, like Blue Cross Blue Shield plan, can you in the future opt back in?
That's a good question. I don't I don't know. Let me answer it this way. When I retired from PwC, Pricewaterhouse, I was in their partner retiree health plan. When I turned 65, I went into Medicare, and they provide the supplement. If I ever opt out of the PwC supplement plan and go to get some supplement insurance, I can never get back in. And that's true in most, I believe that's true in most corporate situations.
I think, and I think Brenda will mention that, basically that the state has basically said you won't be penalized. Now, the question is whether or not you're going to be able to opt out. And that looks like right now, if you opt out, you want to come back in, you'll be able to come back in, they think, and I say they think, that it may not be.
Right, they're in writing. One place is saying for SUAA retirees, you can try Medicare Advantage for a year, and then you could go back in. If you opt out, you can go back in. I don't think that's true for the community college and the teachers. They are under different opt-in, opt-out plans. But the problem is they put some things in one published piece and then contradicted it in something else, and it makes it difficult for us to give you good advice.
One question about CMS. Are there going to be any more information sessions scheduled in Chicago?
The website has the places that are listed. We've complained a lot that Chicagoland was under too few meetings. I had offered UIC as a location, and I did that in September. In fact, I asked CMS to come to this meeting in early September, and they didn't meet with us. They live downstate. They went to UIUC, and they're doing downstate very heavily. Our politicians in this area from several places where we live have complained. Now they're saying, I think there's only one speaker, and they're saying they can add sessions on like December 13th in Evanston area. And I said, that's too late. Again, what I've asked them to do is take the first session and put the PowerPoints up. I mean, we're webcasting this today, thanks to Jim Lindbergh. Why can't they do it? And I said they should post frequently asked questions with answers. I said they should post the policies in detail that your insurance broker might want to help you to decide. Haven't done that. And also the drug formulary. These are things they have. And we can't get the answers.
What about getting the newspapers involved?
Asking to get the media and the newspaper is a great idea. Does somebody have a friend in the newspaper?
No public servant has a friend in the newspaper.
Please be activists. Write letters to your local paper, to the Trip, to the Sun-Times, wherever you want. This is Colin.
The Springfield Journal Statesman, whatever that is. Registered. They cover a lot. I did send an email months ago about this, and I did get a reply. Write to them and tell them. Everybody send an email. Go online, find it. There's an email address for them. I would personally think that you would not want to contact the Chicago Tribune. But Springfield, yeah.
You know, again, I think you got to pick up the phone and call these folks. And your state reps, but also CMS. I'm telling you, somebody down there has the answers to those two important questions. They have them. And you just got to get aggressive and pushy and say, well, we need the answers now. And you just got to keep it up. And then when they call back every day, it's just, You really got to be aggressive in pushing.
So I'm going to end the session today, but I want a round of applause for the gentleman.